Back to 3+U. Even though school does start back in just a few weeks, the summertime heat is going to be around for quite a while, and that means summer allergies are still lurking at every corner. We are so happy this morning to welcome from the Chattanooga Allergy Clinic, Dr. Marc Cromie. Good to see you.
Good to see you.
Okay, so the fact is that June was a rather wet month, so the month of July, it seems like all of a sudden the summer heat has really hit hard.
And what we've had is the summer plague of stinging insects. This is the time of the year where those friendly barbecues, the outdoor family reunions can be dangerous. And what I'm talking about is Hymenoptera or stinging insects, yellow jackets, hornets, wasps, honeybee. These are the critters that can send you to the emergency room, and people die every year of this, unfortunately. And what we're finding is that if you get stung by one of these insects, like in a Coke can, after drinking or just mowing the yard where yellow jackets like to hide in the bushes, if you have a reaction where you have a rash, hives, problems breathing after being stung, then you need to see a board-certified allergist to be allergy tested, because allergy shots can save you.
Well, let me ask you something about that, though, because we all hear those warnings, and they're good to take to heart. But if you're going to have a real severe reaction, is it going to happen fairly immediately?
Oh, yeah.
Okay.
If you have a severe reaction, typically it's within minutes.
Okay.
A typical reaction is within minutes if it's going to be a life-threatening reaction. Okay. And I'm not talking about just localized reactions where you get stung in the hand and your whole hand will swell up. I mean, you get stung in the hand and you have hives all over your body, your lips swell, problems breathing, you could pass out. And these people need an EpiPen or an auto-injector with them at all times, and to be cautious. But as I was alluding to earlier, allergy shots can change this. Your risk of a life-threatening reaction is 60% or more, and within 6 months, allergy shots can reduce that by 97%, down to less than 3% of a shot reaction. So this is one of the few things that we have that actually is life-saving if you are allergic to these summer hazards.
Let's talk about poison ivy for a minute, because I'm one of those people who seems to be abnormally susceptible to it. I think if I'm in 100 miles of it, it's going to find me.
That's right.
But the reactions for people can be different, can't they?
They can, and what we're talking about now is more of a contact allergy. Unlike the pollen allergy, which ragweed is coming soon. Once kids get back to school in September, we're going to have a lot of ragweed out there. But right now the pollen count is low, so our allergies are going to be to contact sensitivities. And this is poison ivy, oak, the roost dermatitis. And what happens after you're out gardening, if you get into a vine, typically 24 to 48 hours, you'll develop a rash that can be bubbly, oozy, and can start spreading and tracking. And this is more of a contact allergy. Now, there's no shots for this. We can treat you with steroids locally, topically, even oral, or a steroid shot if you have severe reactions like you're alluding to. But this is not going to be a life-threatening reaction. This is going to be more of a contact allergy, just like we saw in the news recently about the iPad allergy. So this is something that all my kids have, I know. Me too, my right thumb.
Well, and that's iPads, phones, if they're on your phones
yes.
a lot?
And what they're talking about is nickel sensitivity. And nickel is the #1 allergen contact sensitivity. It was the allergen of the year in 2008 when it came to the Contact Dermatologic Society. And this is in everything. It can be in costume jewelry. You know, the little girls after they get their ears pierced at Claire's may have a rash there. Or it could be after wearing your watch. Sometimes you'll get that that little rash there. But these are for kids playing with the iPad. It's the case, and it has to do with nickel, and it's just chronic exposure. You can't get it out of their hands.
What will you see?
It'll be a rash that'll be red, itchy, and inflamed.
Okay.
At the area where they contact them.
Okay. So again, you just simply treat the rash, and then you either find a cover for that that machine or whatever.
Because you know you can't avoid it, obviously.
Right.
They would die without their iPad.
Okay. You said some people find themselves allergic to sunscreens too.
Yes, particularly in my young patient population, children that have eczema, they're going to find that different things they put on their skin bother them, and may find that 2 or 3 different sunscreens will break them out. So they have to find a particular non-allergenic one, and I use one called Vanacream that you can get over the counter in the pharmacy. You sometimes have to order it. It's non-prescription, but I've got samples of that I give my patients. But often just it's trial and error, finding something that doesn't break them out when they have eczema, because they have very sensitive skin, and then they're out sweaty, they're perspiring, they're in the heat all the time. That can be an issue.
Okay, 2 last questions. One, back to the poison ivy. Is it transferred through the bloodstream or through scratching? Through
scratching. What it is constant exposure to the oil that is the toxin. And it can be on your clothes, it can be your garden, it can be your dog. That's a lot of people will get, their dog will come back in at night and they'll get re-exposed. And so they're like, where am I getting it from?
So don't scratch it.
It's hard to.
I know it. Okay, the other question is, even though we're still in summer, some people might be exempt from these allergies we talked about, but like you mentioned, the ragweed will knock them for a loop.
Yes.
If they go ahead and come in, can you already begin to see some benefits before the fall?
Matter of fact, this is the time of year that I warn my asthmatics particularly. I'm seeing follow-up visits for all the kids that are home for the home for summer. They're doing great, and then a lot of them are doing so well they've stopped their asthma medicines. That's the problem. As soon as the fall gets here, we're going to have an increase in asthma epidemic. September is the #1 month of the year for asthma admissions to the hospital. And it's like, why? It's not even cold. Well, what has happened is people have stopped their daily controlling medicines. They're in a school now that has mold and mildew. The ragweed shows its evil head, and everybody's passing around the rhinovirus or the common cold, and that perfect storm leads to hospitalization. So start your medicines now. Start your nasal sprays if you have allergies. Start your inhalers if you have asthma.
And before that, go to the Chattanooga Allergy Clinic.
That's right. So get on the shots, baby. We can fix you.
How many locations now?
We've got 5 now. We're working on another one soon, folks.
I never know.
Operators, stand by.
I never know the number when you hear Mark. Okay, 6624 Lee Highway is their primary office. You can call them there at 899-0431. One of the many people to answer the phone will help you find the clinic nearest you.
That's right.
And go online to the Chattanooga
Sneeze no
Allergy
more.
Clinic.
Sneeze no more.
And what else is it you say? From
the womb to the tomb, baby.
There
All
you go.
ages. We can see you.
All right, Mark, thanks. We're back with more right after this.